Hey everyone, welcome back to the NJRI channel. It's Dr. J. Bowen here. I'm an osteopath or DO and a board certified physiatrist. And today I'm going to be talking all about shockwave treatment. This is our fourth video in this series, the good, the bad, and the truth about regenerative medicine. Last week I discussed BMAC, and before that I discussed PRP and MFAC. You can look at these videos if you missed them. Today the focus is all about shockwave therapy. If you're enjoying this series, please support us by hitting that like button and subscribing so you don't miss any upcoming videos. It's really important to help our channel, and we thank you for doing it. So what exactly is shockwave therapy? Well, first of all, it's not electrocution. I get that question sometimes, or maybe not at all. People just leave. Seriously, shockwave therapy in the United States actually has its roots in the early 80s, where it was first used to complete something completely different in the field of urology. Back then, the technology was adopted to perform lithotripsy, a non-invasive method for breaking down kidney stones using focused or acoustic shockwave energy. This was a revolutionary approach as it replaced the need for invasive surgery and allowed doctors to target the stones directly without damaging the surrounding tissues. As research has progressed, medical experts began to realize that these focused shockwaves could do more than just break apart kidney stones. They saw that the shockwaves were actually having a beneficial effect on nearby tissues, promoting healing and regeneration at the cellular level. This sparked the idea that shockwave therapy could be applied to musculoskeletal issues. And by the late 1990s or early 2000s, it began to be tested for treating orthopedic conditions like tendinosis, plantar fasciitis, and even delayed bone healing. As with other treatments, we here use data biologics to monitor patient outcomes, get more data so we can improve our understanding for what shockwave is best used for, and understand the realistic outcomes so we can inform our patients and they can make the best choice or decision for themselves. The science behind shockwave therapy is fascinating. Essentially, high energy pulses create some microtrauma or controlled damage to the tissues. This sounds bad, but this is actually similar to when you exercise. You cause some muscle damage and breakdown, and this is a stimulus for your body to repair it so it's better and stronger than it was before. With shockwave, the sound stimulates the body's natural healing responses, increases blood flow, and releases growth factors. Over time, the approach has evolved and more refined devices were developed to deliver precise energy at the areas that need regeneration or the problem sites that you feel. So now fast forward to present day, and shockwave therapy is becoming a more popular tool in regenerative medicine. However, it's important to note that it's not always done right and in the right manner. Some providers use low quality devices with low energy or improper techniques, which can limit the effectiveness of the treatment. That's why it's crucial to distinguish between different types of shockwave therapies available. There are two types of shockwave therapy, and it's really important to differentiate between the two. There's radial pulse wave therapy, or EPAT, which essentially is taking pneumatic or compressed air that goes through the handle of the device, then moves a bullet inside that goes back and forth and delivers that energy to an applicator tip. That applicator tip can be changed for the desired treatment. Second, or the true shockwave, is focused energy. So this has water to cool down as this device generates an acoustic energy, which is sort of a satellite dish or a cone that helps to focus down that energy. It goes about 8 centimeters deep, so if we want to treat some more superficial tissues, what we can do is use standoff pads for the desired level to even treat more superficially. So as I said, radial pulse wave isn't technically a shock wave. It generates a sinusoidal wave, and this can still give you really good clinical results, but it's not the same thing. So we want to make sure we're specific. So think of this as more superficial, and as the energy goes deeper, it sort of pans out and gets less intense. So we generally use it for soft tissue or muscle pains. And it's commonly used in athletic training rooms to speed recovery, to reduce tension on muscle knots and trigger points to get people moving and going. So this waveform or technical EPAT, radial pulse wave, radial shock wave, what people call it, is really best for myofascial injuries or an adjunct to other things that we're doing. So for example, if you have a patient with tennis elbow, we might start with some radial shock wave therapy to address the forearm tension and all those muscles that are irritated as part of that whole chain and not just focusing on one little area in the elbow. This can be then followed up with some PRP right at that tendon insertion that has a maximal problem and speed the recovery. After that, a couple of weeks later, we might do a couple sessions of shockwave to promote the healing, keep the recovery going, and even address some of the surrounding issues that are still problematic. The other kind of shockwave, that true acoustic energy or sound energy we talked about, can be used for more serious bony injuries. Focused shockwave therapy delivers a high energy pulse over a short duration. This, with a key characteristic negative deflection, can cause some healing properties and issues. This essentially means that the wave not only pushes energy into the tissue, but also creates a suction effect, stimulating cellular repair and regeneration in those deep tissues. Because of its power and precision, it's especially effective for addressing deeper tissues like bone injuries, fractures, or delayed healing. However, it's also beneficial on tendons and bones that break down under cartilage. So when you have a knee and you have the cartilage that's degenerated inside, usually that foundational bone can be problematic, and the shockwave underneath there can help support some of that tissue and hopefully improve the recovery of the cartilage and the less pain in your knee. In other countries, particularly Europe, there's a greater availability of these devices, and they deliver true focused energy shockwaves at necessary energy levels. These machines are more advanced and have been used for decades in regenerative medicine, especially in musculoskeletal conditions. However, in the US, the availability of these advanced devices is more limited for several factors, including FDA regulations with approval processes for new medical technologies, but mainly the cost of the machine, and that most insurance don't cover these treatments is why these are in the country. So this is some of the bad of shockwave in the United States. However, there's been some recent traction, and we're seeing more clinics obtain these devices, which is super exciting. To deliver a focused shockwave, there are 3 different technologies. There's the electrohydraulic device, the electromechanical, and the piezoelectric. The electrohydraulic devices generally deliver a higher energy level that translates into a painful treatment that is often performed or needed to be performed under anesthesia, and the machine and the supply cost is quite high compared to other treatment modalities. The electromechanical devices potentially offer the same benefit with less pain, no need for anesthesia, and can be performed in the office, but will require a series of treatments to try to get this energy level into the cells so they can get that same healing level as 1 or say 2 treatments of the electrohydraulic. That's what this machine is, and that's what we use in our office. Usually these treatments are once a week for 3 to 4 weeks. So depending on the problem, true shockwave may be performed in isolation with radial pulse wave, or EPAT as some people know it, and complement a cellular regenerative procedure, such as PRP, MFAT, or BMAC that I previously discussed. That's why it's important to understand the difference between choosing a provider, because some clinics just might offer shockwave therapy and you don't really know what you're getting. But they actually use the devices that are used for maybe superficial treatment, or really not applying a whole global treatment and treating you as an individual and not just your elbow or some other part. At NJRI, we have radial pulse wave, or EPAT, as well as the true focused shockwave devices that we can use to best address one's issues, or a combination of modalities, as I discussed earlier. And as you can see here, with the focused as well as the radial devices. Now for the good, the bad, and the truth about shockwave therapy. Let's start with the good. As I mentioned earlier, shockwave therapy stimulates your body's own healing processes. It's non-invasive, and there are no needles, which makes it appealing to a lot of people, and no pain after the session. The downside is that it can become time intensive, and there's some discomfort during the treatment. You'll need to commit to 4 weeks of treatment, 1 session a week. So when planning this treatment, you need to prioritize consistency of treatment to make sure you see the best results. If you choose to pursue shockwave treatment here at NJRI, the good news is that we have a small practice and have the flexibility to accommodate you and your schedule. Now finally, the truth about shockwave therapy. It might not be widely seen as regenerative, but when it's done right, it's a powerful tool for healing. I believe that shockwave unleashes your intrinsic ability to heal. That's why I offer it. Whether it's for bone or soft tissue treatment, this can make a real difference when patients have it done properly. And also, with the ability to combine it with other treatments like PRP, MFAT, or bone marrow, it's a win. So that's a wrap on shockwave therapy. If you're interested in learning more about regenerative treatments, don't forget to check out our other videos in the series. You can always give my office a call, schedule a consultation, and find out about shockwave therapy if it's right for you. I'd love to meet you, talk about how we can help you unleash your intrinsic ability to heal. As well, always, thanks for watching, and if you found this video helpful, hit that like button, subscribe, and stay updated for the latest content. Hitting that like button and subscribing really helps us out, and we appreciate it. Also, check us out on the socials, like Instagram, X, Facebook, and TikTok. We also have some fun reels and shorts we'll be rolling out over the next few weeks. Thanks for tuning in, and see you next week, when I'll be discussing the controversial topic of stem cells.